Hi, I'm Mayor Miller. Normally you'd expect to find me at City Hall, but today I'm here outside of Fire Station number 1 in the city of West Bend. The West Bend Fire Department has always provided the highest quality of care to the residents of our fine city. In fact, in 1997 alone, West Bend Fire Department ambulances responded to over 1,200 calls for services in the city and surrounding communities. It was just over 20 years ago that the fire department ambulances were staffed with full-time fire department personnel. This allowed an immediate response of the ambulances 24 hours a day, every day, 7 days a week. The greatest challenge tackled by the fire department came in 1995 when fire department emergency medical technicians, or EMTs as they are known, improved their skills through training and began providing a higher level of emergency care. The EMT basics were now EMT intermediates. This new level of emergency care allowed ambulance personnel to initiate advanced life support measures in the event of a medical emergency. The West Bend Fire Department is the first ambulance service to utilize ALS measures in Washington County. Currently in the state of Wisconsin, there are 4 levels of emergency medical services. They are first responder, EMT basic, EMT intermediate, and EMT paramedic. EMT basics are licensed to perform many emergency medical procedures. These include bandaging, cervical spinal immobilization, bone fracture and dislocation immobilization, administration of oxygen, defibrillation, and administration of epinephrine. They are also licensed to transport patients to medical facilities. EMT intermediates are licensed to perform all of the skills of EMT basics, as well as many higher levels of skills, such as starting IVs and administering IV fluids, giving albuterol for asthma, administering dextrose for diabetic patients, Narcan for drug overdoses, and nitroglycerin tablets for heart attack patients. The West Bend Fire Department has recently been chosen as a test site for a state program to increase the skills of EMT intermediates and to allow them to deliver some of the medications that paramedics give to cardiac patients. Some of the advanced cardiac life support drugs that the enhanced EMT intermediates will be licensed to administer include atropine, lidocaine, and Lasix. The city of West Bend is lucky enough to have some of the finest EMS personnel performing life-saving operations on a daily basis. However, these people would not be able to perform their jobs efficiently and effectively without proper administration, leadership, and training. Each of the people who perform these duties have various backgrounds that help them draw from experience to allow our ambulance crews to do their jobs to the best of their ability. Chief Roskopf explains.
I started with the fire department back in 1969, and at that time the only type of training, EMS training we had was more or less of basic Red Cross instruction. The ambulance was run by the paid-on-call people. Then in 1970, the state started the EMT program, and several of us went to become EMTs. And in The paid-on-call EMTs ran the ambulance until 1975, at which time they hired some additional full-time people. And then January 1st of 1976, the full-time people start running the ambulance. They responded for the call immediately when it came in. Before that time, at the time of a call, they paged out the paid-on-call people, and they had to respond back to the station and leave for an ambulance call.
Well, actually, my background or my career in emergency medicine started in 1960, well before there was ever something called an EMS system in Corning, New York. At the time, I had finished my first year of undergraduate school and college, and was undecided as to what I might want to do for the balance of my life. Those are rather tumultuous times for youngsters, young people, people that are 18 and 19 years old. So I took a job working for the Corning Ambulance Service, and was there, worked there for a year, returned to college, and maintained my connection with the Corning Ambulance Service, finished my undergraduate degree, and became a science teacher in Corning, while maintaining my connection with the, again, the Corning Ambulance Service. And then in 1974, I was licensed as a paramedic, and we inaugurated advanced cardiac life support on the street at that time. This was one of the early programs in the nation, actually, the notion of out-of-hospital advanced cardiac life support with a full armamentarium of equipment and drugs, originated in Elmira, New York, in the very early 1970s, in the personage of Dr. William K. Noel, who was professor of the program, but he was also director of the Department of Anesthesiology at the time at the Arnold Ogden Memorial Institute there in Elmira.
I started out in EMS on a volunteer department. In 1982, I obtained my EMT basic license. And then about 6 years later, I obtained EMT defibrillator license. And I was on that department for 10 years. For 3 years, I was a lieutenant of the rescue squad, and then 2 years the captain. Then I came to the full-time West Bend Fire Department in 1992. I obtained my EMT intermediate certification in August of 1995, and now I'm working on obtaining the enhanced EMT intermediate training.
I started in emergency medicine around 10 years ago. I actually went through a 4-year residency program in Oklahoma, came back here to Milwaukee area, and I am board certified in emergency medicine. I'm also a fellow in emergency medicine, which actually you have to be a little higher level to become a fellow. I teach at Frederick and St. Mary's, Milwaukee, both family practice and emergency medicine residencies.
My role is to oversee the program of EMS. We have several people that are involved with doing the day-to-day operations. We have Lieutenant Todd Van Langen, who is our EMS coordinator. He does the training for the EMTs that we have now, all the recertification training. And Battalion Chief Kudik is also involved in the training of the EMTs at this time.
Well, I applied for a job as an instructor in the emergency medical department at Moraine Park Technical College in June of 1976. I was subsequently interviewed and hired for that job. So my seniority here with regard to the emergency medical system in the state of Wisconsin actually goes back to or starts on August 1st, 1976. And during that time, I've been involved in training of first responders, basic EMTs, EMT intermediates, done some paramedic training, and now I am the lead instructor in this program, Enhanced Intermediate Program.
As training officer, it's a diversified role, and it's a challenging role. Our community is growing, and so is our fire department. We're going from 1 station to 3 stations in about a 2-year period of time. I've got to train motor pump operators to be ready to do that. We've got a lot of new fire personnel coming into our department. I've got to train them to do basic fire ground operations, hose pulls, hydrant hookups, things like that. So we've got a lot of fire training just to prepare people for our expansion. And with the EMS, that's also takes up a good part of the training. We did our EMTI program in 1995. We started that in January, and we took the test in June. We're now enrolled in the enhanced EMTI program. That started in January. We're going to be done with the classroom in July, and then we've got the clinicals to do, which may take us into October or November. And then you've got the mandatory education also that needs to be done every year. Some through fire, we need hazardous materials recognition and identification. We need SCBA training, search and rescue training. The EMS part of it, we have to certify twice a year in defibrillator and combi tube training. And it's a lot of mandatory education plus updating our skills and keeping them to where they should be.
My role for the medical directorship for West Bend Fire Department is reviewing run protocols, teaching different skills, lecturing them on different types of patient problems. I also help with protocol development.
The West Bend Fire Department spends a great deal of time learning new skills, such as the 100 hours spent becoming EMT intermediates and the 265 hours that is currently being spent enhancing the EMT intermediate skills, as well as the individual study time by each individual. But you ask yourself, why this higher level of care, or what is involved in this training? Moraine Park Technical College EMS instructor Bruce Furman explains.
The EMT enhanced or EMT intermediate enhanced program is a program of teaching advanced cardiac life support skills primarily to people who are currently licensed as EMT intermediates. Now this has the status of a pilot program. What that really means is that this is an experimental program which is being conducted under the auspices of the Department of Health and Family Services Bureau of Emergency Medicine here in the state of Wisconsin. Moraine Park, for whom I work, has early on expressed an attitude of wanting to be involved in educational programs that do expand the format that shall we say in many ways kind of push on the edges of the envelope, and we're happy and pleased to be a part of this program.
Well, as we started out with the EMTs back in 1970, we've seen a great improvement in the care that we provided for the citizens of West Bend. And then back in the early 90s, we started the defib program, which was a great addition to the EMS program. Of all the things that I've seen, I think this was the greatest thing for EMS in the city of West Bend. All we have to do is go out and look at the amount of people that are alive today because of our defib program. And with the EMS, or the EMTI program, we also have the capabilities of administering certain drugs to people, which helps on the scene for the people to recover from certain things like diabetic coma and things like that. And it also is a start for the hospital ER room so that we start an IV, and they have the chance to put in drugs immediately up at the hospital. They don't have to start an IV after the patient's up there because that'll already be started.
Emergency medical technicians that are intermediate level actually can do more than basics. They can start IVs, they can give certain IV medications, especially in cardiac problems. They can deliver albuterol treatments, which help people with breathing treatments. They can defibrillate. They can give glucose to diabetics whose sugars are low, and they actually can check the sugars. The basic units can't do any of that. So a lot of patients have actually turning around of their symptomatology rather quickly because their treatment's being delivered before they come to the hospital. And we actually see a dramatic improvement in a lot of patients, especially asthmatics and diabetics, before they actually come up to the hospital.
The West Bend Fire Department has some of the most competent and skilled personnel around, both online and in the staff, who perform EMS-related duties. There are many reasons why this is. Training Officer Todd Van Langen explains.
As far as the administration being progressive, I think Chief Roskopf has really looked into the future as far as our training. We were the first department to become EMTI trained, and he aggressively wanted this EMTI enhanced training also. He pursued that and got it. So he's looking into the future. He's looking to benefit the public that we serve to the best of our ability, and he's worked to get that. As far as the personnel, they're very committed to it. I mean, the EMTI was a big advancement in our skills and our training, which benefited people. But we saw with the enhanced EMTI training that is basically cardiac oriented, being able to give those cardiac drugs on the scene. And everyone really realized that how much that would benefit our cardiac patients. So everyone in the department committed to this program. And just through the training and the studying and the work that they're doing, you can see that commitment that comes from everybody, from the top on down.
The West Bend Fire Department has very impressive skills. They're continually training. They're also in programs sponsored by the state for their development of new skills. They constantly reviewing their protocols so that they know exactly how to treat patients correctly.
Well, first of all, I think the people that are the EMTs on the West Bend Fire Department are very dedicated, and I think the administration is dedicated to making it one of the best also. And just from the enhanced EMTI program that we're involved in now, everybody's making a commitment to make it probably the best program around. People are making special efforts to come to classes and get the information that they need to pass the class. One other reason that we've got a great ambulance service is because of the instruction of Bruce Furman from Moraine Park Technical College. He's gone through a lot of effort to make sure that our students are well trained, and we don't just go through the classroom work. He makes sure that everybody knows and understands what they're supposed to do. And also Dr. Matousek, who's the medical director at St. Joe's Hospital, is the same way. And just being good enough is not satisfactory to her. We have to be the best, and we strive to be the best.
They are highly apt students. In education, we have this. We have a statement that we say that nothing glorifies a teacher quite so much as an apt student, and that's certainly in operation here. What you have is a cadre of people who are young and who are dedicated and who are disciplined and who are intelligent, and are able to participate in the depths of a program such as this, as opposed to a superficial participation in a program. So this is the people here have evidence all those attributes necessary to make this a success, and their past success is an indicator of future success for sure.
Many of us are lucky enough to never have contact with EMS personnel in an emergency situation. We often see the ambulance go down the street with lights and sirens, but never get a full appreciation for what the ambulance attendants do and who else is involved in an EMS call. Here we will see a simulated emergency call, almost like you would see on a TV show like Rescue 911.
Western 911. Yes. Okay, what's the problem? Okay, and you reside at 254 Edgewood Lane? Okay, I'll send the fire department or the ambulance right over. Thanks, bye-bye. Westman Dispatch to station number 1. An ambulance is requested at 254 Edgewood Lane, 254 Edgewood Lane, for a subject with chest pains and difficulty breathing. Your cross street is Wisconsin Street. KGG 961, KCJ 488 at 1314 hour.
Dispatch, station 1 copies the ambulance call, 254 Edgewood Lane.
Dispatch, ambulance 3 is en route, 254 Edgewood.
Where's the siren? There are many things that need to be done on the way to an ambulance call. The ambulance attendant makes sure that the defibrillator and heart monitor are working properly and speak into the tape recorder as an official voice record of the call.
Westman Ambulance 3 en route to a possible cardiac code. We have firefighter Forrest, firefighter Gustafson, and MPO Weston on board.
Dispatch, ambulance 3 is on the scene, 254 Edgewood.
Sir, how you doing? What seems to be the problem today?
Chest pains, trouble breathing.
Each call requires that the ambulance attendant gather a patient's history so that they can assess what is wrong with the patient and treat the illness or injury accordingly. Medical procedures that the attendant will perform include assessing the patient's blood pressure and heart rate, as well as checking glucose levels and heart rhythms.
Okay. So when you were outside raking, how long ago did you come inside?
You tell me how.
5 minutes ago.
About 5 minutes ago, okay.
And do you know his birthday offhand?
9.
So I'm going to be undoing your shirt here. We're going to put these sticky patches on your chest. We're going to take a look at your heart.
Give a doctor.
My partner here, Jeff, he's going to be getting some vitals on your arm over there. We got a pulse ox of 94%.
94%.
And a heart rate of 104.
Straighten your arm up.
He was out raking.
He was just out raking and he just came in and to get a little snack and then he said he started having chest pain and problems breathing.
Excuse me. All right. Mike, could you go ahead and put him on some oxygen, please?
Sure thing.
All right, we got one more patch that's going to come down over on this side over here.
114 over 50.
14 over 50.
You take a deep breath, sir.
You want cannula?
Sure, yeah, that'd be fine.
Deep breath.
How you feeling?
Sounds like a little tired.
A little tired, huh? Okay.
Give you some oxygen. These are just going to go in your nostrils. Just take some nice breaths through your nostrils now.
What do we got over there, Jeff?
Should be normal sinus.
Normal sinus rhythm? Good. Okay. So how would you, the pain in your chest, how would you describe it?
Tight.
Real tight, okay. As far as, does it stab, does it squeeze?
Squeezes.
It squeezes, okay. What would you rate that pain as? 1 being like almost no pain, and 10 being the worst pain you ever felt in your life?
About a 9.
About a 9, okay. All right. We're going to do a glucose check, okay?
What's that?
Does he live here?
Yes, he does. He's staying with me now.
Okay. What's the phone number?
335.
Gonna feel a little pull?
All right, we got a glucose level of 99. Okay, why don't we move him on over to the cot? Watts, why don't you grab what other stuff we don't need, take it out to the squad and spike a bag. And Jeff and I will take care of putting him on the cot.
You hang on to this to us first?
Yeah, why don't you help me out moving him? There we go. just going to... Forward a little bit. You're not dizzy or feeling sick to your stomach at all?
No.
Okay, great. All right, forward a little bit. There we go.
When the patient realizes that he needs to go to the hospital for further examination by a doctor, he is placed on a stretcher and taken out to the ambulance.
You got your seatbelt to put on you, just like you're riding in a sports car. Yeah, the O2's kind of in the way. And we'll get outside, we'll call for protocol orders for nitro. And you go ahead and do that, and I'll start the IV. Or do you want to start the IV?
Got 4 steps?
4 steps, okay. Alright, I'm going to call for orders so that nitro, you get that started.
Okay, it still appears to be normal sinus.
Okay. Westbound Ambulance 3 to St. Joseph's Emergency Room.
This is St. Joe's. Go ahead, Ambulance 3.
Yeah, St. Joe's. We're en route to your facility with a 72-year-old male patient of Dr.
Here we see the attendant calling the hospital and advising the emergency room that the ambulance is currently with a patient, what the patient's condition is, and requests to administer nitroglycerin to this patient to ease his chest pains. Meanwhile, the assistant attempts to start an IV so that this patient can receive IV fluids. The assistant cleans and sterilizes the site prior to insertion of the IV catheter.
Over 50, pulse of 104, respiration 16, 0 brains, paramedic there. And he never did lose consciousness. Pupils are equally reactive. Skin was pale, diaphoretic.
Okay, you're going to feel a little pulse, okay?
Pulse ox was 94% on room air. We now have it up to 99% on 4-leading O2. Breast stones are clear bilaterally. We ran a glucose that was 99. And what we'd like to do is go ahead with 1 dose of nitro at this time. And that's okay. What else? I'll let for protocol.
Keep us advised of any changes. KVM 354 clear.
Need a little help there, my friend?
Yeah.
All right.
Okay, we got flow.
I'll open it up for you. We got flow.
Okay.
Backing it off. Okay, let's secure that. Sherwin? Okay, how you doing, Otto? Didn't hurt too bad, did it?
No.
Okay. I got your sharp. Okay, the hospital's given us permission to go ahead and give you a pill. It's called nitroglycerin. All it is just a little tiny pill. We're going to place it underneath your tongue, okay? So if you can just open your mouth and do this. There you go, right in there. Close your mouth. Does it taste kind of bitter? All right. Well, that means it's working. Might give you a little bit of a headache, though, okay? And
I'll get a blood pressure on him.
Great. Get a blood pressure in a minute or so.
Due to the patient's chest pain and previous cardiac history, it is decided that the ambulance will go to the hospital using red lights and sirens to minimize transport time. Once the patient has been transported to the hospital, he will be examined by a nurse. The nurse will gather information from the ambulance crew, such as whether or not the treatment given by the crew has had any positive or negative effects on the patient's condition. Once that is completed, the nurse will gather an extensive history, reassess vital signs, and prepare him for a visit from the ER doctor.
Hello, how is everyone today?
How you doing, Jill? This here is Otto.
Hi, Otto.
Otto was out raking leaves and got some chest pain.
Okay.
We got permission for 2 orders of nitro from Dr. Lewis.
Okay.
His pain started off as a 9, it is now down to a 3. Last set of vitals was 106 over 60. Pulse stayed the same, about 84 throughout. And
Give yourself a big hug,
respirations are
Otto.
60.
You're gonna move you over on the other bed here.
Okay.
Tubing clear?
How are you feeling, Otto?
Okay.
Do you have any pain?
A little bit.
Okay.
Okay.
On your count.
1, 2, 3.
I like white patients.
Okay.
Okay. Is Otto comfortable?
Okay. It's a 18 gauge in the back of the hand, and I think that's about it. Oh, let me take our patches from here.
Once the call is completed, the ambulance has to be cleaned up and the equipment put back into working order so that the crew is ready for the next emergency run.
We're
Hey guys,
available.
all set?
Yep.
Okay. If you could, sir, throw that out for me.
You want me to call for times?
You can call for times, and if you want to...
The last step in the call is also completed at the hospital. Each ambulance run has to be documented on an ambulance run report form. Every detail from the run is recorded on the report.
that would be 385.
Hi, this is Mike in the ambulance. Can we get times, please?
And phone is 338-2459.
Yeah, he's doing
Yeah.
fine.
Throughout this program, we have seen that there are many people responsible for helping our fire department provide the best ambulance service possible. But there are many people behind the scenes too. These people perform many functions, including maintenance of vehicles, equipment, as well as ordering and stocking of emergency medical supplies. The West Bend Fire Department has gone through many changes in its history. But what does the future hold for West Bend's emergency medical services?
If I look back and to take a look at where we've come from and how far we've come, I think we've come a long way with EMS in the city of West Bend. And I think that in the future, probably down the road, paramedics will probably be a goal At this time, I don't think it'll be within the next couple of years, but probably further down the road, paramedics will probably be a possibility. And there's also a possibility that we can start doing some intercepts with other departments if they would want us to do that, because sometimes the heart drugs that we will be able to give from this enhanced EMTI program may save someone's life if we can get involved in the intercept program.
Right now, the West Bend Fire Department's in a pilot study with the state to go to actually a higher level of service in which they will be able to deliver cardiac medications and certain medications for people who have congestive heart failure. It's like a stepping stone to a paramedic level. We're hoping in the future that they will go to that. They are also in development with a lot of community projects, and in the future, paramedics and EMTs will probably be doing more care in the community than they are actually now. So their role is going to rapidly change.
Well, the West Bend Fire Department Emergency Medical Services in the future, where they will be is forever onward and upward. We're living at a time when there is a tremendous amount of increase in general technology, and particularly in medicine and biology, and we have a whole biological science explosion going on in this country. And so as technology becomes available for consumption, then that becomes a part of the level of expectation that the taxpayers of the city and the area would expect. So consequently, that we are responsive to the technological era in which we live. So to say that we're going to stop at any particular terminus or station along the way just is not the case. This department has evidenced strong desires to be part of the advancing and expanding body of technology and EMS, and I would expect that would continue on into the future.
Well, in the future, I think we're going to continue to try and progress. I myself, what I would like to see is the paramedic level, and I would think eventually someday we're going to reach that. And then just to continue, it's a changing field too. Things are changing in the EMS, and this is a progressive department. We try and stay on top of that change. But as far as advancement, paramedic would be the highest level that we could advance to, and that is the next step that we would be going to.
As our city grows, the fire department finds many new and exciting challenges that need to be overcome. One of those challenges is the building behind me, the West Bend Fire Station number 2. The new fire stations that are being placed throughout the city are strategically located to minimize response time for fire and rescue or ambulance personnel. As you may or may not know, Emergency Medical Services Week is May 17th through the 23rd. Be sure to take the time to show your support and appreciation to the West Bend Fire Department and fire-based EMSs. So in the event that you have a medical emergency, please remember to dial 911 for the quickest response as well as the highest quality and level of care.